Dissemination of findings on the interplay between gender and health outcomes, experts say there is a need to examine how policies address gendered health challenges in a bid to ensure equity. Gloria Milimu with that story.
Gender experts are now calling for incorporation of gender considerations in health formulation processes in a bid to help advocate for change geared towards the realization of health equity. The experts from the African Population and Health Research Center, who have for the last 3 years since COVID-19 analyzed the extent to which policies address issues around gender and intersectionalities like health, argue that gender equality and health equity are key to better health for all.
During COVID, what we saw is while women were more likely to be exposed, more men died from COVID. And what does that tell us? It tells us that either men could have been disadvantaged because their health-seeking behavior is poor already because of the norms around seeking care.
For instance, their studies found that the older one grows, the higher the risk of getting hypertension. Notably, they found that this risk remained higher among women compared to their male counterparts between the age of 60 and 70 years.
Between 18 and 29, the risk is higher the prevalence is higher amongst males, right? But then, as they grow older, it's like they're going 19, 22, 30, 38, 50. The ladies, on the other hand, they're like 11, 18, 35, 49, 63. And so, at 60 to 70 years, the risk of hypertension is higher amongst the women.
They advise that the role gender plays in determining health outcomes cannot be overlooked. Hence, the need to formulate gender-responsive policies and health professional regulation through all levels of health governance in a bid to ensure gender parity and universal health coverage.
We have to understand and unpack how sex and gender or other determinants, social determinants of gender actually intersect, so that we understand how our response should be organized and how the health system should be organized.
Some of the barriers to gender responsiveness, they say, include budget allocation to facilitate research on developing gender-responsive policies and also implementation of some of those policies, among other barriers. Gloria Milimu, KT News.
Kenya's counter-terrorism efforts have started bearing